So you know you need to ask a lot of questions, but do you sometimes not really even know what you need to be asking? So given the fact that medication errors are one of the leading causes of patient harm, here are the 6 questions I ask every time a new medication is prescribed. So first off, you need to know the basics. So if you don't already understand, make sure you ask about the medication details. What is the name of the drug, the prescribed dosage, and the frequency? So number 2, most people out there understand why a medication is being started at a high level, like to control pain or your blood pressure, but not many really understand the impact to their health at a deeper level. So the impact. So I always like to ask, what changes should I expect and what's the level of impact I should see in my health? This saved me one time really critically. I was started on BP meds. I asked the doc this. This was supposed to get my systolics down to about 110, 120. So when I got that first 90 systolic reading, I knew my dosage was off. So I was able to intervene and, prevent an ED visit. Number 3, real talk. You are going to consume something that is going to physiologically change your body. So you have to ask about side effects. Otherwise, how are you ever going to know pros and cons of the medication? And so number 4, going along the same line of thinking, you have to ask if there's any specific things that would make it harmful for you to take this medication. So think things like an allergy or pregnancy or medications that don't mix well. And number 5, this is something that gets missed all the time. You need to ask about timing and next steps. So, hey doc, when should I expect to see the changes? And when's an appropriate time for you and I to connect again so we can really evaluate how well this medication is working for me? And lastly, if you can't afford this new medication, all of this is irrelevant. So you have to ask, does my insurance cover this? And if not, your care team should be working with you, your manufacturer, and other resources to evaluate if a discount is available or if we need to look at an alternative. So we understand advocating for your healthcare is absolutely critical, which is why we focus on asking really key questions like this to make sure that we truly and deeply understand these concepts so we can best advocate for our care.